Order. Call the honourable member for Lyne.
Thank you, Mr Deputy Speaker. When I saw this matter of public importance, I thought, what's happening here? What are our wrong priorities towards nurses? I had to scurry back to my office and look through all our documents that we'd put through in the campaign and in the budget. And to be truthful, Mr Deputy Speaker, I was hard-pressed to find anything specifically that wasn't beneficial for nurses. And then today in question time, we hear of visitors from the Health Services Union and other unions here, and then the penny dropped, like most of you realised, that this is a bit of a beat-up for the people in the unions that are controlling far too many members on the other side of the House. Now, I think if you look at things rationally, maybe they're upset about the fact that when we were in government before, the Coalition introduced practice payments for nurses. Surely they couldn't be upset about that. Maybe they don't like the idea of 500 scholarships for nurses for up to $30,000 to train particularly those in rural and remote areas. They keep on going about this mythical $50 billion worth of cuts. But when you look at it, the payments to the states actually go up. What they're complaining about is the increases aren't as prodigious or unrealistic or unsustainable as the previous ALP government made out. So there's no cuts. To me, a cut means what you get next year is less than what you got this year. But things are going up and up. As many speakers here today have pointed out, 9%, 9%, 6%, and then the usual precedent is by CPI and population growth. So this idea of cuts, it's absolute rubbish. And these members on the other side should be held account for scaring the bejesus out of half the people that depend on the health system for their well-being. Now, I've worked for 33 years in the health system, and I don't know anyone in the health system who has ever complained about a cut in bureaucracy, and that's what we're doing. I mean, the last time I was in A&E and there was blood going everywhere and someone was exsanguinating, I didn't say, "Quick, get me a clipboard," you know. I need a few more paper clips. I need a new position statement. You know, that is what we're doing. We're directing what precious money is in the health portfolio into frontline services. We've also got a $331 million practice nurse incentive payment. Maybe they're complaining about $331 million dedicated to getting more nurses in private practice. Just like they're complaining about 9% more, 9% more, 6% more. You know, it's just ridiculous, and it strikes me as actually quite confected anger. They haven't got anything else to complain about, so they brew up this major storm about these mythical cuts, when in fact things are going up. There's also $80 million for clinical training programs for nurses. Who could complain about that? So there's one policy after the other, funding that's going up, yet they're complaining. Now, in my area, what have we seen from the previous government? We've seen $7 million tied up in my hometown for a super clinic that's been in construction for 3.5 years. You know, and it still hasn't seen one patient yet. You know, and you hear the stories all around the country of all these super clinics that are white elephants or underutilised or not utilised, and you know, it's just ridiculous. Practice incentive payments for infrastructure. That's going to expand the capacity of existing practices rather than super clinics. Now, they also make a big deal about the $7 co-payment. Sure, it is going to change the behaviour in general practices. Hello! That's why it's been introduced, because it was unsustainable. It was unsustainable. It is sending a price.
Order,
to both
order.
the doctor and the patient. And the system, if it's going to be sustained, needs it.
Order, order.
Thank you, Mr Deputy
Member
Speaker.
for Lyne got the call for 2 seconds. Order.